We've got Fiona with our next question. Thanks, Fiona.
Hi, so my question is regarding something really close to home. With the maternity wards, especially during COVID, there was many cases of which women were turned away because the maternity wards were so inundated. It seems that every woman you talk to who's had a child within the last 5 years has either had a horror story or knows someone who's had a horror story. And I'm just interested, if you get elected, what are you willing to do in order to ensure that women are getting the proper care they deserve and having children, especially in our public hospitals, the ones that are government funded?
Let's go to Chris Minns.
Yeah, well, thanks, Fiona. It's a really important question. I don't think there's any doubt that our public hospital system is in crisis at the moment. And it's in many cases in a worse condition than it was even during the worst parts of the pandemic. I know that our frontline workers are doing it extremely tough. I mean, here's some of these statistics. We know that 66,000 people walked into an emergency department and turned around and left without getting any treatment. 1 in 10 have to wait longer than 18 hours to get a ward place. And there's 100,000 people on the waiting list, including 4,000 children. And I've spoken to nurses at Blacktown and Westmead Emergency Department. Over 30 have resigned from both institutions in just the last 12 months. Now, think about the implications of 30 senior nurses who work in that institution for the people of New South Wales up and quitting because of the pressure. It's one of the reasons we're going to invest in skills, conditions and removing the wages cap. Firstly, in relation to skills, we're going to offer 2,000 scholarships every single year to train up nurses and healthcare professionals, paramedics as well, so they work in our public hospital system. We're also going to ensure there's safe staffing levels. 1 nurse for 3 patients in emergency departments, 1 nurse for 4 patients on the ward. And of course, the wages cap's got to go too. All I'm proposing in relation to the wages cap is that we have the ability to sit down and negotiate with frontline workers, the people that saved us during the pandemic, like every other state in Australia is able to do.
Are you talking sort of 1% on top of what they've got at the moment? That's the PBO, the Parliamentary Budget Office, said that'd be $2.6 billion cost across 3 years. Is that the sort of range you're looking at?
So we're proposing that we remove the wages cap so we can have that conversation. At the moment, Kieran, we've set aside $41.9 billion for wages, rising to $45.9 billion worth of wages in 4 years' time. But anything above that, we want to have an open dialogue and negotiation. And the reason for that is if we go in with strict principles around budget savings and productivity gains, we think we can make a difference and keep people in New South Wales.
OK, let's hear from the Premier, because is that reasonable to say if he's elected, he'll have the conversation when Premier of the state?
It would be reasonable, Kieran, and it would be reasonable to everybody at home or here today, that when you have a major budget costing, that you come clean and say what it's going to cost the taxpayers of New South Wales. And the wages policy from Labor, wages accounts for about 40% of the state's budget. By removing that cap, you unravel that cost, and that has real consequences. And what Chris is saying is that this major policy of giving increase for wages for public servants without telling anybody what it is would be akin in your own family budgets in releasing 40% of those costs and removing that cap. Imagine if you went home to your partner and you said, we're going to put a new kitchen in, a major renovation. Well, what's it going to cost? $0. And that's the costing that Chris has come up with. Well, it's not going to cost $0. So how is it going to cost that? Well, because we're going to find the savings. Well, if you can't say what the cost is, you need to say what the impact on the budget is and what that means.
But how do you keep the nurses in place, the doctors in place, as Fiona has said, to answer her question directly, to improve the medical services in the state?
What I can say is we want every single person across New South Wales to have the best healthcare possible. And when it comes to our health care professionals here in New South Wales, we're recruiting 10,000 more over the next 4 years. In terms of nurses and midwives, 3,600 are starting. That is the largest increase in the history of New South Wales and the largest increase in Australia. Our healthcare workers today are 3,000 more in total numbers than there were last year in the height of the pandemic. But we need to do more. And that's why in New South Wales, when you go to an emergency department, 77% of patients are seen on time compared to 67% across the country. Now, we need to do more. We need to continue to invest. It's $33 billion, a third of the entire health budget. But here in New South Wales, we have the strongest health system in the country. And we have health ministers from around the country coming to New South Wales to see how we do it. But we always want to make sure
Premier,
that wherever you are in this state, you have access to the best healthcare possible.
thank you.